My name is Brad Pennenberg. I'm an orthopedic surgeon at Cedars-Sinai, and I'm the division chief of the hip and knee service. Needless to say, as a surgeon, I use my hands every day at work in the operating room. For the last 5 or 6 years, I've had progressive increase in pain and locking of my right middle finger. We use metal instruments, and the exact location where the instrument contacts the middle of my palm is exactly where the trigger has been, and probably is the reason that it started in the first place. It was getting worse, and over time it took an actual kind of effort to unlock my finger, and I've been challenging Dr. Kulber to figure out an easy operation so that I would have no time off and get rid of the awful locking sensation. After a few years, David told me he was ready to do this arthroscopic procedure and release the trigger finger. The idea was to avoid an incision in the palm, and a few hours before I was supposed to get on a flight, a 10-hour airplane ride, we did the procedure. I was awake, and he allowed me to watch, and it was as straightforward and simple as he proposed that it was going to be. Dr. Kulber tells me that the device he used is called an EndoSleeve, and I guess that facilitated the ability to insert the scope and visualize the area and minimize trauma to the trajectory of the device. Access the pulley, visualize the pulley, and allow access for the cutting tool, and be able to see it and be able to access and do essentially the procedure under direct vision. He was very efficient, and it went very smoothly, and the healing process was essentially negligible compared to the techniques that I was familiar with when I trained as an orthopedic surgeon, and the technique for making the incision directly over the pulley be, I believe, a completely different experience, particularly for someone who works with their hands. Based on my needs, my circumstances, I couldn't imagine it going any more smoothly. No question, I'd have it done the same way again. It was extremely straightforward. David was right. He did kind of perfect the procedure. I think it took all of about 20 to 30 minutes. Pain was minimal, pretty much non-existent. Took some Tylenol. I was going to do it again. I'd probably do it on a Friday afternoon and be ready to go to the OR on Monday. For someone whose daily activities involve gripping and holding instruments in the hand, I think the absence of an incision in the palm is essentially a game changer in terms of thinking about the aftermath of this kind of procedure. You know, as minimal as it seems, most people, they'd probably take a month or two off from work if they had an incision in the palm. The surgical procedure itself, my experience at least, was essentially really minimally traumatic. We talk about minimally invasive surgery in a variety of contexts, but this is about as minimal as I can imagine.
We are AM Surgical, and this is AM Innovation.